All right, now
Now examine the cranial nerves by testing their motor and sensory functions as appropriate.
Okay.
Although smell and taste usually aren't tested unless a problem is suspected.
Smell, is that okay?
That's fine.
Okay.
Begin by evaluating the olfactory nerve, or cranial nerve 1.
Now I need to press one nostril closed. Can you still breathe?
Yes.
Okay. What I'd like you to do is close your eyes
Okay.
and tell me what you smell.
It smells like rubbing alcohol.
That's correct. Now I'd like to check the other side.
The patient should perceive the odor on each side and identify it correctly most of the time.
That smells like coffee.
And that's correct too.
Next, assess the optic nerve, or cranial nerve 2. To do this,
Now I'd
test
like to
distance
check the
vision with a Snellen chart and near vision with a Rosenbaum
Your
chart,
right eye, please.
as in the eyes video in this
Hold
series.
this card 14
The patient should have 20/20 vision.
and read the smallest line possible from left to right.
63925.
That's correct.
Also, test the visual fields by confrontation. The patient's peripheral vision should be comparable to yours.
Say now, when you see my wiggling fingers move into your line of view.
Now. Now. Now.
Now test the oculomotor, trochlear, and abducens nerves, or cranial nerves 3, 4, and 6 together. As in the eyes video,
straight ahead.
assess these nerves by inspecting the eyelids, which should have no drooping, and by checking the pupils, which should be equally round and reactive to light and accommodation.
Thank you. I'd like you to look straight ahead and follow my moving finger with your eyes, and don't move your head.
Okay.
Also evaluate the extraocular muscles by having the patient watch your finger move through the 6 cardinal positions of gaze. Eye movements should be well coordinated and full, with no jerking or drifting. Next, assess the trigeminal nerve, or cranial nerve 5. To do this, inspect the facial muscles, and then have the patient clench her teeth while you palpate her jaw. Facial expression tone should be symmetric, with no atrophy, tremors, or fasciculations.
And relax.
For a young child, watch for bilateral jaw strength as she eats a cracker. To assess any cranial nerve in a child, modify your technique as needed, for example by playing a game.
Good.
I need to check the sensation of your face. May I have your hand, please?
Yes.
I'm going to touch your
After
face.
demonstrating sharp and dull sensations with a paper clip or broken tongue blade, have the patient close her eyes. Then touch each side of her face on the forehead, cheeks, and chin,
Sharp.
randomly testing sharp and dull sensations, which the patient should identify correctly.
Sharp. Sharp.
Thank you. Now I'm going to check the light sensation on your face. When you feel the cotton wisp, please say now.
Also, randomly stroke
eyes
the
again.
same areas with a brush or cotton
Now.
wisp, and have the
Now.
patient say when the stimulus is felt.
Now.
She should feel this light
Now.
touch in all areas.
Now.
Thank you.
Then check the corneal reflex. With the patient
Now,
looking
check
up
your
and
corneal
away,
reflex.
lightly
Make
touch
your
one
look
cornea with a
but that's
cotton
normal.
wisp. Then touch the other.
Look up and to the left.
Both eyes should blink symmetrically, though patients who wear contact lenses may have a
Turn
diminished
your
or
chin to the
absent
left.
reflex.
And look up and to the right. Thank you.
Next, assess the facial nerve, or cranial nerve 7, along with the glossopharyngeal nerve, or cranial nerve 9. Observe the
Now I would like to
patient
check
as
the
she makes
movement of your
specific
face.
facial
I'm going to
movements.
ask you to make several movements, okay?
All right.
Can you raise your eyebrows and wrinkle your forehead? Good. And smile, but don't show your teeth. And puff out your cheeks. Good. And purse your lips like you're going to whistle. And show me your teeth.
All movements should be symmetric,
And close your eyes
with
tightly.
no tics or drooping.
You can relax.
To assess
Now I
taste,
need to do a
use
taste
4 flavored
I'm
solutions.
going to put a drop of solution on your tongue, and I'd like you to tell me what it tastes like.
Okay.
Can you stick out your tongue and hold it there, please?
Apply a solution to the side of the tongue and wait for the patient's
Can you tell me what
response.
that is?
Sour.
Good.
Then offer a sip of water and test another solution. The patient should properly identify each taste.
Okay, we're going to try one more time. Please stick your tongue out and hold it.
To continue, evaluate the acoustic nerve, or cranial nerve 8.
Now I'd
As
like to
detailed
check
in the
your
ears, nose, and
Can you put
throat
your
video
finger
in
in
this
your right ear
series,
and wiggle it?
perform the whispered voice
Repeat
test.
what I whisper, please.
In each ear, the patient should hear the words you whisper from 1 to 2 feet away.
Purple. Ball game.
That's correct. Now I'd like to check your other
Next,
ear.
do the
Now,
Weber
this is
test,
tuning fork
in which the
inside of
patient
your
should
head.
hear the vibrating
Tell me
tuning
your
fork
equal
equally in
both
both ears
or
with
better.
no lateralization.
Equally in both.
Thank you.
Also perform the RIN test,
going to place
in
this
which the
behind
patient
you.
should hear the vibrating
Okay.
tuning fork by bone conduction about half as long as by air conduction.
It stopped.
Can you still hear it?
Yes.
Please tell me when it stops.
It stopped.
Thank you. Now we'll check your other ear.
An older adult is likely to have conductive or sensory neural hearing loss, which can alter the results of the Weber or RIN tests. Now check the glossopharyngeal nerve further, along with the vagus nerve or cranial nerve 10.
Now I need to check the back of your throat.
To test
Can you
these
open wide,
nerves,
please, and say,
inspect
"Ah"?
the soft palate.
Oh.
The soft palate should rise symmetrically, and the uvula should be midline. Next, assess
need
the
to check
gag
the gag
reflex.
reflex. Can
When
you
you
open
touch
wide,
the
please?
posterior wall of the pharynx, the patient should gag, and the uvula should stay midline. Then have the patient drink some water
Now take
while you observe her ability to swallow.
And swallow. And again.
The patient should swallow easily, with no water passing back through the nose. Also consider the patient's
Great.
speech.
How did that feel?
I had no problem swallowing.
You should hear no hoarseness,
No, thank you.
nasality,
Quite enough.
or difficulty with guttural sounds. Now test the spinal accessory nerve, or cranial nerve 11. To do this,
need to check your
evaluate the
neck.
size, shape, and strength of the trapezius and sternocleidomastoid muscles.
Is that okay?
Yes.
And shrug your shoulders up. And don't let me push them down.
Okay.
The shoulders should rise symmetrically.
Good. And relax. Now turn your chin to the left and press against my hand
In both directions,
And now
muscle
turn your
strength
chin to
should
the
be
right.
symmetric and full.
and press against my hand.
Finally, test the hypoglossal nerve, or cranial nerve 12, which is usually tested with cranial nerves 9 and 10.
I need to look at your tongue, please, when it's relaxed and when it's moving. Could you open your mouth and stick out your tongue?
The tongue should be symmetric, with no fasciculations, atrophy, or deviation to either side.
And move your tongue from side to side. And curl it up like you're trying to touch your nose. And try and touch your chin. Very good, you can relax. Last of all, I need you to press your tongue against your right cheek,
The patient's tongue should have full muscle strength on both sides.
and now your left cheek. And relax.
That seemed like a pretty thorough exam I've had here today.
Again, listen to the patient's speech. She should have no difficulty pronouncing lingual sounds, such as L, T, D, and N. Even though the neurologic system is highly complex, with the right questions and examination techniques, you can assess your patient's mental status and cranial nerves with ease. And when you consider these findings with those from your examination of the reflexes and motor and sensory systems, you'll be able to judge your patient's neurologic status fully and accurately.